In beginning this dissection, it's important to note that there are three compartments to the leg. A posterior compartment, seen back here, a lateral compartment, and an anterior compartment. And if you recall or remember the nerves to these three compartments, it can help you to organize the muscles and their innervations. Let's start with the lateral compartment. You'll remember that the sciatic nerve divides into two components, the peroneal and tibial nerve, as it passes behind the back of the knee. And we see right here the peroneal nerve, the common peroneal nerve, as it's diving down right by the head of the fibula to enter this lateral compartment. This peroneal nerve will divide into superficial and deep peroneal branches. We're interested in the superficial peroneal branch because it innervates the lateral compartment. There are two muscles in the lateral compartment that you have to find. The peroneus longus on top, which courses down the lateral side of the leg and behind the lateral malleolus and into the foot. Deep to the peroneus longus is the peroneus brevis, which does exactly the same thing, coursing behind the lateral malleolus and into the foot. Now we've moved to the posterior compartment of the leg, and the first thing we'll do is to reflect the large triceps surae muscle, which includes the gastrocnemius and the soleus muscle. The gastroc has been reflected as well as the soleus, and I'll pick up the gastroc first, move it to the side, and you'll notice that there's a skinny little tendon with a small belly attached to it, known as the plantaris muscle. This muscle can be reflected along with the gastroc and the soleus. You will then carefully reflect the soleus because there are some nerves and arteries running underneath, just deep to the soleus, and as you cut this muscle off of its attachments onto the posterior tibia and the interosseous membrane, you want to be sure to preserve the artery and nerve that travels underneath of it. So that muscle has also been reflected. We'll pull it to the side. Now you can see the arteries and nerves that are traveling just deep to the soleus. This large nerve here is a continuation of the sciatic as its tibial branch. That supplies the posterior compartment of the leg and continues down into the foot, where it will branch into the medial and lateral plantar nerves and supply the plantar aspect of the foot. The artery that travels back behind this soleus muscle is the posterior tibial artery. Posterior tibial artery is a continuation of the popliteal, and what happens is the popliteal artery crosses the knee, becomes the tibial artery, and the tibial divides into posterior and anterior tibial arteries. You can see here that the division point is right there, and you can just make out the anterior tibial artery as it dives deep through the interosseous membrane to gain access to the anterior compartment of the leg. The posterior tibial artery continues on down, and you can see it here, to course behind the medial malleolus of the foot. And on its way down, it gives off another small branch known as the peroneal artery. This branch right here is the peroneal branch. That will gain access to the lateral compartment of the leg and continue on to the lateral surface of the foot. Now that we have the gastroc, soleus, and plantaris moved out of the way, we're going to look at the deeper muscles of the posterior leg. They include the tibialis posterior muscle, the flexor digitorum longus muscle, and the flexor hallucis longus muscle. These three muscles are oftentimes considered to be the Tom, Dick, and Harry muscles of the leg. And we use that because there are three muscles that basically follow the exact same names in the anterior compartment. And let's look at the distribution of these muscles in the leg. The most superficial muscle on the lateral surface of the leg is the flexor hallucis longus. This large belly right here is flexor hallucis longus. It continues down behind the medial malleolus and into the foot where it attaches to the big toe. The more medial muscle is the flexor digitorum longus, this muscle right here, which also continues down behind the medial malleolus and into the foot where it attaches to the other four toes. Deep to these two muscles, right between them, and underneath the artery and the nerve, you can see the tibialis posterior muscle. Okay. You can see the tibialis posterior muscle. This muscle also courses behind the medial malleolus and into the foot. The nice thing about these three muscles is as they course behind the medial malleolus, and I'm going to try and move the camera over to the medial malleolus now to show you how they pass behind the malleolus. They actually have a very regular arrangement such that if this is the malleolus right here, the tendons can be seen as going tibialis posterior, flexor digitorum, and flexor hallucis is actually deep down here. You can just see the flexor hallucis right there. So they go Tom, Dick, artery, nerve, and Harry. So the three muscles, tibialis posterior, flexor digitorum, and flexor hallucis longus, are in order behind the medial malleolus. That can be a nice little tool for remembering the muscle and the position of those muscles. Now we're going to look back up to the knee joint and look at the last muscle that is in the posterior compartment of the leg, a deep muscle which can be seen here known as the popliteus muscle. Popliteus muscle crosses from the lateral femur to the medial tibia and is seen here as the deepest muscle in the posterior knee. Now we're looking at the anterior compartment of the leg and onto the dorsum of the foot, and we're going to consider the three muscles that are arising from the tibia and interosseous membrane in the anterior compartment. Once again, these muscles are innervated by the deep peroneal nerve, which was a branch of the common peroneal after it wrapped around the head of the fibula. The three muscles in the anterior compartment are easy to see based on their insertions into the foot, so you'll want to dissect these out as they continue on into the foot. First of all, we have the so-called Tom muscle, the tibialis anterior, which you can see passes medially onto the foot and around to attach into the plantar aspect of the metatarsals. Then we have the extensor digitorum muscle, which consists of these four tendons, one going to each of the smaller toes. That's extensor digitorum. And then finally we have extensor hallucis longus, which is this long tendon right here that goes to attach to the big toe. The last muscle that arises from the anterior compartment of the leg is a small muscle that attaches to, it looks like it's part of the extensor digitorum longus muscle. It actually is a separate muscle known as peroneus tertius. You can tell this muscle from the extensor digitorum longus because it does not attach to the phalanges, but instead attaches to the base of the fifth metatarsal, and you can see that right here as it comes down to attach to the base of that metatarsal. That would be all of the muscles that you need to find in the extensor compartment of the leg. Now we're going to move down to the foot and look at the dorsal and plantar aspects of the foot. Now we're looking at the dorsal aspect of the foot, and there are two muscles that you need to find in the dorsum of the foot. They are a short extensor for the big toe known as extensor hallucis brevis, and you can see its belly right here and its tendon continuing out onto the big toe. And then lateral to that would be a short extensor for the other toes, and you can see the muscle belly of that short extensor filling in this whole area, and you can see the tendons coming off of that and also passing into the rest of the toes. There's one, and here's another one. And they all travel just deep to the extensor digitorum longus muscle. Okay, I want to look at an artery that is an important artery for you to find in the dorsum of the foot. It's known as the dorsalis pedis artery. You can see it right here. It's a continuation of the anterior tibial artery. And it is an artery that can be used to take a pulse if you have difficulty taking a radial pulse. So you can see dorsalis pedis right here, traveling just deep to the extensor hallucis brevis muscle. Now we're looking at the plantar aspect of the foot, and we're going to look at the plantar aspect of the foot using prosections, beginning with the superficial layers and working our way down to the deep layers. Generally, it's considered that there are 4 layers of muscles in the plantar aspect of the foot. Before you get to the layers of muscles, though, the first thing you're going to reflect, or first thing you're going to notice on the prosections will be a very tough aponeurosis known as the plantar aponeurosis. This is very similar to the palmar aponeurosis that you saw in the hand. If we remove that plantar aponeurosis and flip it out of the way, we'll see the first layer of muscles that forms the most superficial layer in the foot. These are known as the abductor hallucis, which can be seen right here. It's a large muscle. The abductor digiti minimi on the lateral surface, this muscle right here, and the flexor digitorum brevis right there. Well, if we reflect these three muscles, it'll take us to the second layer of muscles, and I'm going to do that now. Reflect the abductor digiti minimi out of the way, reflect the abductor hallucis out of the way, and reflect the flexor digitorum brevis out of the way. Now we can see the second layer of muscles, and we can also visualize the continuation of the tibial nerve behind the medial malleolus and into the foot. First of all, the tibial nerve, you can see, is splitting into two branches here, known as the medial and lateral plantar branches. The posterior tibial artery will also follow these two nerves and break into the same branches, which we have not shown in this dissection. Now, the second layer of muscles includes two long tendons, which can be seen coursing behind the medial malleolus. First of all, you can see the flexor hallucis longus tendon right here, and you can see the long tendon to the other toes, the flexor digitorum longus tendon right there. The other muscles of the second layer of the foot include two muscles that attach to the flexor digitorum longus tendon. And these two muscles would be the quadratus plantae, which can be seen passing from the calcaneus to the tendon. This muscle redirects the pull of the flexor digitorum longus. And then also attached to the flexor digitorum longus tendon are some tiny little muscles that you remember from the hand, known as the lumbricals. These pass to the medial side of each of the lateral four toes. Now we're going to look at the third layer of muscles, but to do this we're going to move to another prosected foot, just as you'll have to do when you view the various layers in your lab. Now, looking at the deeper layer of the plantar aspect of the foot, for references, let's look at some of the structures you're already familiar with. You can see that this is the tendon of the flexor hallucis longus. We're going to leave that intact. This is the flexor digitorum brevis muscle, which we've already reflected out of the way. And this is a nerve that we just looked at, the medial plantar nerve, which we'll move out of the way. Now we're going to pick up and cut through the tendon of the flexor digitorum longus and the lumbricals as they attach onto the toes. And we can pick that up out of the way. And that will expose the third layer of muscles in the base of the foot. We can see this third layer includes a short muscle belly that goes to the big toe, known as flexor hallucis brevis. And you can see that muscle belly right there, flexor hallucis brevis. It includes a muscle on the lateral side known as flexor digiti minimi brevis, which is this belly right here, and two heads of a muscle known as the adductor hallucis. And we can see both of these heads, the oblique and transverse head, filling in the space in the middle of the foot. Here's the oblique head right here, and here is the transverse head just underneath these cut tendons of the flexor digitorum longus muscle. That finishes up the third layer of muscles of the foot. Now, to look at the last layer, we're going to have to go to another prosection and reflect all of these third layer muscles and get to the deepest layer of muscles, which consists of the interossei. We're going to do that next. Now we're looking at another prosection which demonstrates the deepest layer of muscles, known as the interossei. There are 7 interossei in the foot, and they have functions similar to the 7 interossei that you found in the hand. So they're known as dorsal and plantar interossei as well. If we pull out the oblique head of the adductor hallucis to the side, we can see these deep interossei muscles right down in here. These muscles are also innervated by the lateral plantar nerve.